Aloha Medical Mission was founded in 1983 to provide free medical services and supplies to poor areas in the Philippines, Southeast Asia, and the Pacific. Our primary purpose is to help people too poor to get proper medical care.
Just being involved with the mission to me is doing medicine in its purest form, being able to help other people that need help, not being worried about charging, and just being able to help people that truly need your care.
Because the need for medical treatment is endless, every year we partner with health organizations in host countries to fund medical missions. We have increased from 1 to nearly 20 overseas missions in 1 year. We have held joint goodwill missions with the U.S. Navy and the Hokulea voyage to Micronesia to offer humanitarian assistance programs to countries overseas. Our volunteers are our strength. More than 4,000 licensed medical nurses, doctors, and even non-medical volunteers give their time and their own money to go on these missions. The impact they have on the lives of these patients is immeasurable.
We see the long lines of people that have come to receive eye care, and we go there and we typically will see them and tell them that we'll be able to do surgery then the next day. And the next day we operate like from 7 o'clock in the morning till midnight, and we're not even finished. But to see the joy in these patients' faces the next day when we take their bandages off, and to just see them look around them and they say, I can see, is such a tremendous experience.
Aloha Medical Mission also began a free interim medical and dental clinic in Hawaii in 1995. As an interim clinic, we see patients only a few times with the goal of connecting them with permanent services elsewhere. Clients include the homeless, immigrants, and the newly unemployed. We have treated more than 70,000 Hawaii residents to date, and we are the only clinic of this kind in the state. Aloha Medical Mission changes the lives of thousands of individuals every year by providing free medical treatments to those in need and by transferring lifelong skills to doctors overseas. Recognizing the need for more permanent medical services in underserved countries, volunteer physicians established a surgical training program for doctors overseas and exchange fellowships for visiting doctors in Honolulu.
Our normal day starts at around 7 a.m. So 4 times a week we do outpatient clinic. We just do ophthalmological procedures and do follow-ups in the eye diseases. And then twice a week we do surgeries for the whole day. So we do cataract surgeries, eyelid surgeries, and orbital surgeries and removal of tumors. My main goal is to really be able to help my patients, and I can only do that if I really am equipped with the proper skills and knowledge.
We look for fellows who love to give and whom I think will give back to the community. Fellows who have, whom I at least can sense, have a sense of compassion, of caring for their fellow human beings. If the fellow already is imbued with these characteristics, then they're able to even more carry out the ideals of the Aloha Medical Mission.
Our services are made possible by generous donations of time, talent, and resources from our noble volunteers, and additional support from community organizations and people like you. With your continued support, we can pursue our ultimate goal of establishing hope and medical relief in underserved areas into perpetuity.